There may not be a new official medical update from Ojai Raptor Center today, but that doesn't mean the investigation has stopped. In fact, some of the most important clues may already be sitting right in front of us. Over the past 2 weeks, Ojai Raptor Center has shared blood tests, medical imaging, and updates showing that Jackie's condition has changed several times. Individually, each update tells us only part of the story, but when we put those pieces together, a much bigger picture begins to emerge. Today, we're not trying to diagnose Jackie. Only her veterinary team has access to the complete medical record. Instead, we're going to examine the publicly available evidence and ask the same kinds of questions that wildlife veterinarians naturally asked when a critically ill eagle doesn't follow the recovery they expected. Let's start with the very beginning. Clue number 1. The fight was more serious than many realized. Before Jackie disappeared, there was the confrontation. Many viewers remember seeing Jackie defending her territory against younger bald eagles. At first glance, it may have looked like another territorial dispute, but after watching the footage carefully, one thing becomes very clear. This wasn't simply two birds crossing paths in the sky. The interaction lasted much longer than a typical aerial chase. For significant portions of the encounter, the birds remained very close together, sometimes on or just above the ground. Why does that matter? Because once large raptors lose the advantage of open flight, the nature of the fight changes completely. Instead of quick strikes and separation, the birds can become physically entangled, talons locked together. Body weight is transferred directly onto muscles and joints. Powerful wing beats become pushing force. Every movement requires enormous energy. Now add another important observation. Jackie wasn't dealing with just one opponent. She appears to have been confronted by two younger sub-adult bald eagles. Whether they attacked simultaneously or one after another, the numerical disadvantage alone would have made the encounter far more demanding. Could this kind of prolonged struggle produce significant trauma? It certainly could. Deep muscle injury, hidden bruising, or even internal bleeding are all recognized possibilities after violent raptor conflicts. Whether any of those injuries actually occurred in Jackie's case is something only her veterinary team can determine. But we need to be careful. The footage cannot tell us exactly what injuries Jackie suffered, and we should never claim that it does. Instead, the video gives us something equally valuable. It tells us the mechanism of injury was likely much more substantial than a brief mid-air collision, and that becomes important because of what happened next. If the fight started the crisis, Jackie's blood work suggests that something continued long after the fight had ended. And that leads us to the following clue. Clue number 2. The blood pattern nobody can explain. Most people focus on one number, PCV, and understandably so. A value below 10% is critically low. But after looking through every official update, I think another clue may be even more important. Not the number itself, the pattern. Let's look at the timeline. When Jackie first arrived, her PCV was dangerously low. After receiving treatment and a blood transfusion, that number improved. It climbed into the mid-teens. For a moment, there was real reason to feel encouraged. Then, it started falling again, from 18% to below 10% once more. That isn't the steady direction people naturally hope to see after a successful transfusion, and that's why this pattern deserves attention. Notice that we're not saying the treatment failed. We're not saying the veterinarians missed something. Instead, we're asking a much more useful question. What questions might they be asking as they look at this changing pattern? The first question could be, is Jackie still losing blood somewhere? Not necessarily from a wound that anyone can see, but somewhere inside the body. The second question, could red blood cells be disappearing faster than they should? If red blood cells are being destroyed after they circulate, even transfused blood may not remain in the bloodstream for long. The third question, is Jackie's bone marrow producing new red blood cells fast enough? That question becomes especially important because Ojai later performed a bone marrow biopsy. That isn't a routine test. It's the kind of diagnostic tool veterinarians use when they're trying to understand why severe anemia continues. And finally, there's another possibility veterinarians often keep in mind. Could supportive treatments themselves influence the laboratory numbers? For example, Intravenous fluids can sometimes dilute blood values slightly, but dilution alone would rarely explain a persistent return to critically low PCV if nothing else were happening. Notice something interesting here. Every one of these questions points in a different direction. Blood loss, blood destruction, blood production. That's exactly why this case has become such a medical mystery. The most important clue isn't simply that Jackie's PCV became critically low. It's that it refused to stay up. And perhaps that explains something else we've learned recently. The veterinary team decided it was time to look even deeper. Clue number 3. Looking deeper than a normal X-ray. When Ojai Raptor Center announced that Jackie underwent a contrast CT scan and later a bone marrow biopsy, it told us something important. The veterinary team wasn't simply treating an injury anymore. They were searching for answers. But what kinds of answers? Most people are familiar with X-rays. X-rays are excellent for showing bones. They can reveal fractures, joint injuries, or obvious abnormalities in the skeleton. But they have limitations. An X-ray compresses the entire body into a flat two-dimensional image. Different tissues overlap one another. Small abnormalities can be hidden, and many soft tissues simply cannot be evaluated in detail. That's where CT becomes different. A CT scanner creates hundreds, sometimes thousands, of thin cross-sectional images. Those images can then be reconstructed into a three-dimensional view of the body. Instead of looking through the body, veterinarians can examine it layer by layer. That level of detail allows them to investigate structures that an X-ray may miss. That doesn't tell us what Ojai found, but it does tell us what they may have been looking for. A contrast CT can help veterinarians evaluate things such as hidden internal bleeding that may not be visible externally, deep muscle injuries, damage to internal organs, pockets of infection or inflammation, enlarged organs, abnormal masses or tumors, and abnormalities involving major blood vessels. Now, it's important to be very clear. We are not suggesting Jackie has any of these conditions. These are simply some of the reasons veterinarians choose advanced CT imaging when a critically ill patient isn't following the expected course of recovery. But the CT scan was only part of the investigation. The second test may be even more revealing: a bone marrow biopsy. Bone marrow is the body's blood cell factory. It's where new red blood cells, white blood cells, and platelets are produced. So when a patient develops severe anemia, one of the most important questions becomes, is the bone marrow responding the way it should? Under the microscope, they can evaluate whether the marrow appears active, whether it's producing healthy blood cell precursors, or whether something may be interfering with normal blood formation. Depending on what they see, the biopsy may provide clues pointing toward very different possibilities. It may suggest an appropriate regenerative response after blood loss, or it may raise questions about disorders affecting blood cell production. In some cases, bone marrow examination can also help identify inflammatory conditions, certain infectious diseases, marrow infiltration by abnormal cells, or blood-related cancers such as leukemia or lymphoma. Again, we have absolutely no evidence that Jackie has any of those conditions. We're simply explaining why veterinarians perform this type of test in cases of unexplained persistent anemia. Another question many people have asked is, if the biopsy has already been done, why don't we have the answers yet? The reason is that pathology takes time. If the findings aren't straightforward, additional special stains or laboratory tests may also be needed before a final interpretation is made. In many veterinary laboratories, a preliminary impression may sometimes be available within a day or two, but a complete pathology report often takes several days, and in more complex cases, even longer. That timeline is entirely normal. So today, we followed 3 important clues. A confrontation that may have been more severe than many people realized, a blood pattern that refuses to follow a normal recovery, and advanced medical tests searching for answers beyond the obvious. None of these clues tells us exactly what is wrong with Jackie, but together, they reveal something important. This is no longer simply the story of an injured eagle. It has become a complex medical investigation. Perhaps the biggest clues are not the ones we've already seen. They're the ones we're still waiting for. What did the CT scan reveal? Did it identify injuries that couldn't be seen before? Is Jackie's bone marrow producing enough new red blood cells? Or did these advanced tests point the veterinary team in an entirely different direction? Those answers remain in the hands of Ojai's veterinarians, and until they're ready to share them, they remain some of the most important missing pieces in Jackie's medical mystery. In our next video, we'll explore another side of this mystery. Until then, we'll continue following the official updates, and we can keep hoping that the next clue brings Jackie and her medical team closer to the answer they need.